welcoming you all to the episode 4 of the Anxiety Disorders webinar series hosted by the Anxiety Disorders Clinic, Unit 5, Department of Psychiatry, NIMHANS, Bangalore. At the very outset, I extend a warm welcome to all the dignitaries and the listeners present here for this online webinar. It gives me immense pleasure to see all the stalwarts of psychiatry whom we all have uh, had the privilege listening to and learning from. The theme and the title for today's episode is What Makes the Book Stress and Struggles Worth Reading. I even have a hard copy of the wonderful book here. It's an exhaustive and very comprehensive book which has touched upon almost all the aspects which a psychiatrist should know when it comes to the term stress. And for this, today we have the eminent speaker, Dr. Bettahalasoor S. Somashekar, sir, with us. I extend our warm welcome to you, sir.
Thank you, Sarabjit. Thank you very much.
And we also have Dr. Santosh K. Chaturvedi, sir, with us. I extend our warm welcome to you, sir. We also have Senior Professor Dr. Srinivas Murthy, sir. Welcome to you, sir. And we also have our other editors, that is Dr. Pratik, sir, and Dr. Bhavika, ma'am, also with us here. Welcome to you both. Let me take a minute to just introduce Somashekar, sir, to the audience here. That sir graduated from Government Medical College, which is currently known as Vijayanagar Institute of Medical Sciences, VIMS, Bellary, India. And later, he has spent nearly 10 years in NIMHANS, where he obtained his MD, diploma in psychiatry, and also DNB in psychiatry. And he has contributed a lot towards the community psychiatry while he was here. And he has obtained his PGD MLE from National Law School of India, University, Bangalore. And currently, for the past over 20 years, he's working as consultant psychiatrist at the Coventry and Warwickshire Partnership NHS Trust, Coventry, UK. And also, he has authored many scientific publications in national and international journals and written several chapters for the books. And Sir's specific interests include phenomenology, psychopharmacology, stress and mental illness, community psychiatry, legal and ethical aspects of medicine. And Sir also has a keen interest in teaching, training, and doctor's health. We welcome to you for this episode, sir, and we request you to kindly take over and begin your talk, sir. Thank you very much.
Yeah, thank you, Gajanan. Thank you for that introduction. I am extremely delighted to be part of this anxiety group where you are disseminating a lot of information to both professionals and public. This gives me a great opportunity to tell about what we have done related to stress and struggle. Since this is the book which was edited by six of us, so obviously we would be keep telling about my book is best. However, it is the reader who has to give the verdict. So what I'm going to do in the next maybe 20 to 30 minutes is to give an idea about how did this book come about, and also little bit highlights about the book, what you can get from this book, and also at the end we will ask the readers who have read the book to give their views. So this stress and struggle, the second edition of this book, the following are the editors, and I am sure you are familiar with many of them. Dr. Manjunatha is currently additional professor at NIMHANS. Professor Chaturvedi retired from NIMHANS and currently working at Vrindavan. And the other three, Bhavika, Mohammed, and Pratik, are higher senior trainees in UK now. They are due to become consultants very soon. So this is the format of my presentation. First, I'll give you a brief idea about how this book came about and highlights from the book, and at the end, request the readers to give their opinion. So why did I thought about bringing a book on stress? So when I moved to UK, I started to see quite a lot of people under stress, and many of them did not had actually a diagnosable mental illness, but they were still needing some help from mental health professionals. Thus prompted me to think about different aspect of stress. And these are the questions came to my mind. Is stress unique to human? What actually stress is? This is a very common term we use in our day-to-day practice, in our day-to-day conversation, but do we really know what it is? And is it a single entity or is it a spectrum? And how stress and mental disorders are related. This is really an important part because many people believe that there should be some kind of a stress or a life event for someone to develop a mental health problem. Whether that is true, and does stress cause mental illness, and are there any anti-stress medication, and what are the other methods of treating stress related problem? So these are few questions, and many more questions were in my mind. So what we do when we have doubts about any subject, so we start reading about it. So I read literature about stress, and what I came across is some of the points I have just noted here. So literature clearly recognizes that stress is a common clinical problem. However, the stress is filled with a lot of ambiguity and individualistic views. And what some of the stress literature is does is it gives an oblique reference to stress in their articles, and then went on to describe about what causes it and what can be done about it rather than really giving an idea about what stress is. So this is what really made me to really read more about this, and also whether stressors or life events as etiology for mental illness. This is commonly discussed in many of the literature, and I didn't find a clinically an approachable method to understand relation between stress and mental illness. And quite a lot of research, especially in the 19th century and 20th century, was focused more on the life events and related to mental illness. But in the recent past, there is a lot of research on biological aspect of stress also. So then I try to find a source where I can get all this information in a single place. But unfortunately, I didn't find. So they were all bits and pieces and described in textbooks, some articles. So what I did was I uh, sorry, I compiled a brief summary for teaching purposes because I do have higher psychiatry trainees and foundation year trainees and psychiatry trainees as my trainees. So that to educate them, I made a brief summary. But unfortunately, I was not satisfied with the amount I read and then compiled, as the amount of information about stress is so exhaustive, and I really got stuck. So, what do we do when we get stuck? Like most of us do, we go to a guru. And my guru and mentor, Professor Chaturvedi, was always available for me whenever I need any help like this. So I approached him and I said, I am really stuck with this, and I am thinking of actually writing a book about this, but I alone cannot do. What do you suggest? So he suggested that there are people who are interested in this, and he was also happy to be part of it. And then we identified people whom we knew who can help us, and many of these are my teachers, some of them are my contemporaries, and some of them are my trainees. So I approached them, and I should be really fortunate that I got such a positive response and support from everyone we approached. And I don't think anybody declined to write when we requested. And that resulted in bringing up the first edition of the book. The first edition was published in 2001, and these were the editors at that time. In addition to the three of us, Dr. Amini Devardhan and Devendran and Dr. Shalini Nayak were there in the first edition. And the first edition had 36 chapter. The book was 670 page, and the number of contributors was 69, and the book had 6 parts. Following this first edition, I received positive feedback from people who have read the book, and the more positive feedback I got from people who are my trainees and my contemporaries, as well as people who are read about this but they were not part of the book in the first edition. And many actually informed that they are also interested to contribute a chapter for the book, and that resulted in adding another 16 chapter to the second edition. All the 36 chapters, many of them are edited. We retained them from the first edition, and not all, majority of them were updated to the include the recent evidences. And the number of contributors increased from 69 to 106, and the bulk of the book increased from 670 pages to 900 pages. And we divided this time the book into 10 parts. So you can imagine that when there are 106 professionals who are, majority of them are in academic institute or dealing with stress related problem and also teaching. So you can imagine the amount of information we have gathered through these authors. At this stage, I would really thank everyone from my bottom of the heart for their hard work. There was no incentive for them. Despite that, they took efforts to spend time, give mental space to understand these issues, and wrote fantastic thing. Whatever they have written is really a distillation of years of their experience and knowledge. So in the second edition, as I said, it has 10 parts based on the broad themes, and that 10 parts we made them into 10 parts for practical utility. And it helps the readers to navigate to their areas of interest instead of reading the whole book if they don't have enough time. Although there are 10 parts, they are not mutually exclusive. There will be a degree of overlap. So I'll just, from now onwards, I'll go through the different parts of the book, giving a little small highlights from each part of the book. So the part one covers these areas. Uh, so I spend a little longer time on this compared to other parts because I have written some of the chapters in this part. The most important thing is it gives conceptual understanding of stress. What stress is, what does it mean, how people define it, what different professionals see stress has, and what are the theoretical model to understand stress, and also about the biological aspects, the resilience, accelerated aging, and also issues related to diagnosis. Many people in your practice probably come to see you and you recognize that they are under stress, they have some issues, but they may not meet diagnostic criteria. What do we do with those kind of people? So this is also been highlighted in the second edition, and also explore a relation between stress and mental disorders in little more detail. When it comes to the historical aspect, I have actually gone into as far as 17th century, when was the first time the stress word was used to describe stress. It is not actually in the life sciences, it is in the engineering. I'll come to that a bit later. So then just a question to all of you. Is stress unique to human being? As I said, these are the questions which came to my mind, and I try to find answers to them. So what I discovered is stress is universal. It is not just a human experience. It happens in animals, organisms without a nervous system, plants, even in inanimate objects. So the reason why I read about all these things was I was very keen to know what stress is. So this pulled me to read about even subjects which are outside of our scope. And to my astonishment, there is so much of literature about stress in other branches of science, other non biological sciences. For example, engineering, in engineering subjects, the stress description is so clear, the concepts are much more clearer than what actually we use. And to give an example, Um, the stress in engineering term is very simple, and they have described it as if an external force is applied to an object, for example, metal, it either push or it causes tension that they call as push and pull, and that results in distortion of the metal to counterbalance these force. And what they call the external force as stress, and the metal, the reaction of the metal as strain. So these two terms are so simple, and we don't use them in our sciences, in life sciences. And these are some of the concepts actually can be considered to be used in our branches so that it becomes more clearer when we read about stress. And similarly, there is a huge amount of literature on stress in agriculture. For example, what kind of signs plants show when they are not under an ideal situation to grow by changing the color, changing the shape. And also, there are very different methods to quantify the amount of stress. So, what I'm trying to say is that there is a huge amount of literature outside life sciences, and there is huge scope to borrow from that. So, this book, I have not gone into all those things in the book, but this is reading those chapters can stimulate people to really go into that and borrow some of the concepts. So, then it comes to the question about what actually stress is. So the stress can be seen from different angle. It depends on the professionals who uses the word stress. So from the engineering approach and from the sociological point of view, stress is seen as a stress. It means stress actually happens to man from an external agency or external environment, and the person reacts to that, and that is called stress response, and that is what physiological approach. In this, stress happens in man, and the psychological approach, the integrated approach, look at stress as a product of the interaction between the individual and the external environment. So I understand that all these models overlap, but clinically we have to look into all these aspects. So that is why we can see stress as a is not a single entity. It has different components. From clinical point of view, it is important that we look into all these three components, but it is important to compartmentalize into different components for the purposes of research. For example, it's easy to do life event research where stress is a stimulus from the sociological point of view. And from biological point of view, one can look at the response and the psychology and psychological approach. People who work on those areas can look into the interaction. So then how can we approach to understand the relation between mental disorders and stress? So there are four way of looking at this. This is my own understanding. So one is stress and mental disorders may be just coincidental. They may not have any relation to each other. It means that a person may develop an illness like schizophrenia and also have a bereavement or unexpected life event in the family. Both are not related to each other, but they may have some influence on each other in terms of course and prognosis, but they may be just coincidental. Similarly, the next approach is stress causes mental disorders. I think this is one area. It is recognized in the classificatory system, and there are separate section on trauma and stress related disorders both in ICD-10 and DSM-4. So what it means is these are the disorders where stress actually is a prerequisite for making a diagnosis. It's not just present, it is necessary, without which we can't make the diagnosis. To give an analogy, in psychiatry, we don't have an etiology for most of the disorders. And one example where there is an etiology is acute deficiency of thiamine, which can cause Wernicke's encephalopathy. These group of disorders are similar to that, where the trauma or the stress is actually the cause for this. So this is discussed in subsequent in the part 2 of the book. I'll go into little more details there. And the next way the stress interact with mental disorders is that stress contributes to mental disorder as a predisposing factor, a precipitating factor, perpetuating factor, or maintaining factor. Probably this is the area where stress plays a major role in our day-to-day practice. And the next, but not the least, is mental disorder causing stress. So imagine suffering from a serious mental disorder is a very challenging thing for both individual who suffer and also to the family. So that itself can cause stress. It means that mental disorders here are not caused by stress, but it is causing stress to individual and family. So when we have these kind of approaches, it helps in individualizing treatment, formulating different treatment approaches. So this is just a pictorial representation of the relationship. Yeah, so now is stress a spectrum or a single entity? So stress is a spectrum, as you all agree with me that a small amount of stress is required for everybody to really function optimally. It acts as a stimulus, and as the degree of the stress or the intensity of the stress increases, it moves from stimulus to an optimum level where person achieves more. But when it crosses certain limit, it becomes distress, and when it goes beyond someone's ability to control, it can cause trauma. However, it is important to differentiate trauma from the usual stress. Is that trauma conceptually or qualitatively different, and that itself require a different discussion. So I don't go into more details. But what is more important is the next stage, the post traumatic growth. This is the area where more and more people are interested in understanding what happens after a person resolves their stress or resolve their stressful situations. Person develop something or improve in their personality, or they feel lot better in coping with the similar experiences. So that post-traumatic growth is something which is a new phenomena, and people are working more on that, including biological changes. This is a diagram taken from the book. This is what we have explained in the book. I will give few examples of these things, but I don't describe them. I just put the picture for people to just get an idea what is in the book. So this is another diagram used in the book to explain how stress is a spectrum and different terminologies. And this is a diagram in the book which explains about the biological effect of stress and how the symptoms are caused, and what happens biologically and what are the clinical consequences. So then, as I said, the part two of the book is related to the disorders which are exclusively caused or presumed to be caused by stress. And these are all the chapters which are covered in that book, in that section. And each of the author has actually gone into in-depth understanding and analysis of these areas. And some of the examples from the book, the tables they have used, say, for example, this they have enumerated the risk factors and organized them in a very understandable manner. And this book on this chapter on PTSD summarizes the currently existing treatment. Means it actually provides an evidence-based treatment for PTSD. And part three is probably the biggest part of the book, which try to explore the relationship of stress with major mental disorders like psychotic disorder, bipolar, depression, and also chapters on sleep, eating, sexual disorders, and also models about personality disorders and stress. So the advantage of reading this book is this is not just about stress and mental disorders. Uh, the the authors have done provide extensive information about the prevalence, the onset and course of the illness, and the way it can be treated, um, and with an emphasis on role of stress in these disorder. So what I'm trying to impress is reading this part of the book actually helps for especially for postgraduate students to understand the major disorders itself. in various aspect of those disorders. So these are some of the diagrams which I just copied from the book. So this is a book which looks at genetic what happens to genes when there is psychosocial stress. Yeah, there are multiple diagrams. It becomes too difficult to really include everything in one 20-30 minutes presentation. But there are plenty of the illustration in the book. So part three of the book looks at the addiction. I'm sure you all agree that the stress and addiction are closely linked. People use or give an excuse to use substances to relieve their stress. And there is a chapter on tobacco, alcohol, and cannabis. And these are some of the illustrations used in the book to describe how it is related, what can be done about it. This is another diagram which is used to illustrate the relationship between stress and cannabis use. And the part five of the book, which looks at specific population, it is not just about stress in women, it is stress across the different ages of women. And also there are chapters related to old age, children and adolescent, the special population like migrated and refugees, LGBT. So all these are chapters which go in depth to understand the effect of stress on them and what is the mental health consequences of that. So these are some of the example pictorial representation, the illustrations used in the book. So this explains what are the different kind of issues the woman faces at different ages, like body image as young adults and vasomotor instability and social isolation as they get older, and lot of things in between. And again, another diagram which provides how the symptomatology is related to stress in women. The same thing about the old age. So as I said, I don't go into more details about this because of time. And so this is another diagram. Stress and society. I just spent a couple of minutes on stress and society because this is something which is very important given the current um, uh, geopolitical scenario. I mean, you agree with me that stress, yeah, has an impact on society and it is very profound. It influences both physical, mental health of the individual and also social life, affecting the productivity and overall quality of life. And in this sense, the stress can in the society can be broadly divided into micro environmental factors and macro environmental factors. The micro environmental factors are where individual has some control on that stressful situations. For example, change in family structure, roles, increasing self-reliance, and ambition to achieve things. So these are situations where person has control. The micro-environmental factors are the political situation, political influences, environmental calamities, and kind of work we do, like dominant and subordinate roles. Um, so over years being working in psychiatry, I have come to a conclusion, not necessarily conclusion, belief that humans are both victims and perpetrators of stress, and they are the most severe and common stressors to oneself and others. It's not only that they suffer, they also make others to suffer. So this is an area which is dealt in more detail in almost all chapters related to the next section, and also in different chapters. So the next section of the book is on stress and society, and there is a chapter on each of these areas, and this is one of the illustration uh, using the diagram to give the relation between stress and crime. And as I said, there are many diagrams similar to that. And the next is stress and health professionals. I mean, you all agree with me that a healthy doctor will provide good care to their patients. We should be healthy ourselves, and also all professionals who are involved in helping other should also be healthy and have a good quality of life. So this section looks at the stress related to health profession, what happens to their occupation, and also interestingly, one of the chapter is added about the residency, psychiatry residency, and the stress associated uh, with doing psychiatric residency. I'm sure most psychiatry residents like this book, like this chapter, and not just about what problems people experience because of stress. It also looks about what can be done at workplace. So these are some of the pictorial diagrams shown used in the book to describe stress and healthcare professionals. So I'm coming towards the end. The part two of the book looks at stress and technology. The technology is growing at such a fast pace that all of us are trying to catch up and never reach that recent advances easily. So what it is causing? It is causing stress in using technology, sometimes feeling lagging behind, not up to date, and a lot of comparison between people. What effect does that has on human beings, and also effect of stress on the developing mind and use of artificial intelligence. 1 year old is given mobile phone nowadays, and what happens to their learning because of all these things? This is a fantastic chapter. I have read this, and it gives such beautiful information to explain how this can be prevented and how it can be used effectively also. And there is also about resilience, how one can manage the stress, and a chapter on positive aspect of technology, developing telepsychiatry. So this is one of the slides, a diagram used in the book to describe about the benefit of telepsychiatry, how it is developed and how it is being implemented, especially in demands. So then there is a section on stress and miscellaneous topics. We have included the chapter on stress and physical health here. In my opinion, this topic, stress and physical disorder, its physical health, itself is deserves a separate book. But we included here for the completion sake, and also we all deal with physical health problem even when we are treating patient with mental health problem. And a new chapter included about stress and disaster. And there is also references to COVID and related stress in almost all the newly updated chapters and new chapters. And this is a diagram used to describe about the common reactions, symptoms, diagnosis related to stress and stress and technology. Last slide regarding the different part of the book. Part 10 book looks at management of stress, and there are 5 chapters which cover different aspect of the stress, pharmacology, medication, traditional methods, and also a chapter on prevention as well as how to improve community to cope with the stress. And just another 2 slides about the management issue. So, how do we treat currently people when they come with stress-related problem? So, professionals decide what kind of treatment to be given based on our presumptive idea about the reason for someone's mental health problem. If it is psychological, we ask them to go to psychologist and get psychological treatment. If we think it is biological, like schizophrenia or bipolar disorder, we use medication. But this is an artificial division. Both biological and psychological stress, it is sometimes impossible to differentiate. And in my opinion, what is psychological is ultimately biological. In the sense, all psychological stress we experience, all environmental stress we experience has some effect on our biology and the effect on genetic expression, and they manifest differently. And there is evidence to say that chronic poverty increases the adrenal cortex size. So we can't just differentiate or distinguish like it is psychological and social and biological. So we can't deal anything which is psychological. So we do have methods to treat using medication. And this is the chapter which actually explores the evidence whether there are any medication, irrespective of the diagnosis, can be used to improve stress and reduce the effect of stress on the body and mind. And if they are symptomatic, we can treat them irrespective whether they meet criteria for diagnosis of, of an accepted mental disorder. And the chapter on psychological therapy summarizes. I know that you can't read this slide, but this gives a detailed account about the existing theories and therapies and the key components, how it is helpful in the book, in the chapter on psychological therapies for stress. And this is a chapter which covers about preventive measure. And the important thing here to remember is that management of stress is not just responsibility of mental health professionals or social workers or psychologists. It is the responsibility of everybody, including society, the NGOs or friends, counselors, family. So everybody is responsible in managing stress. So this chapter provides a guidance or advice about how to instill knowledge and skill in society. And finally, how this book can be used. So this book can be used by reading all part of the book for a very comprehensive understanding about the stress, the concepts, and how it affects stress, how it affects different disorders. And also it can be used going into the specific area of the book where the person is interested, because each each part of the book covers different aspect. So that is very helpful if somebody just want to look at about the stress related to women. Going into the chapter will help. Similarly, it can be used as a reference book as we have covered wide range of topics. And also, what we would recommend as editors is to read the first part of the book, as it gives the foundation which can help in grasping the subsequent chapters more effectively. This is the recommendation for medical student, postgraduate trainees, and anybody who is currently doing their PhD or in studies. So who would benefit from the book? The likely beneficiaries are postgraduate trainees in any of the specialty related to mental health, medical disciplines which deal with people with mental health problem like cardiologists, general physicians who see so many people with stress related problem, and also chronic medical condition. Any chronic medical condition will have a component of stress, and it is important that they have an understanding how to manage that, how to help them. And psychiatrists who are experienced, who are practicing, can use this as a refresher and as a reference to look at the latest evidences. And also it aids researchers and academicians to develop concepts, as I suggested in the beginning about borrowing concepts from other specialities like engineering, agriculture, and whether they can be used. In my opinion, the descriptions are much more simpler, more clearer than the way we are using it. So those concepts can be extremely useful, and also for policymakers to decide how their intervention can help in managing stress in society at large, and make healthy and happy society. And I think this is where I will start. And hopefully, there are few people who are joined, have read this book, and want to give their opinion. I would ask Gajanan to look into that, and we can take the questions towards the end.
Yes, sir. Uh, First of all, thank you very much for providing insights on how the book has come up, sir. As you told, the other side of the table, that is the readers, I would request we have a few here in the webinar who have joined, who have read the book, I would request the next 5 minutes to be utilized for the reader's perspectives on what they have felt and how has a reader's experience been in going through the book. To begin with, I welcome Senior Professor Dr. R.S. Murthy sir to share his views, sir.
Thank you very much. Good morning, good afternoon, good evening, depending on where you are. Nice to see friends like Santosh and Dr. Ghosh. Stress has been a very important area of interest for me. Let me tell you why. When the first year, one of the first seminars that I did in PGI in 1972-73 was on life stress and psychiatric illness. At that time, the two articles in Psychological Medicine by Brown and Harris had come about life stress and psychiatric illness. Then I presented that. Then it was so, and as it happens, I had 3 months of holiday when we went on a strike. So I used that time to contact Holmes and Rahe, Brown and Harris, and did a very good review of it. So much so, then I published it as an article in the Indian Journal of Psychology in 1975, a 10-page article in 75, where I ended up saying that the present knowledge points to another instance of folklore being folk wisdom. There is an urgent need to study this area, evaluate these potentials for the study of etiology of psychiatric illness and its prevention at different levels. What I want to say to the audience is that this book is a very, very good book and a very comprehensive one, very big one. And congratulations to all of you for bringing out this area. I can go on appreciating it, but I want to share with you some of the limitations that I find it. I have read completely about half a dozen paper areas of my interest, like aging, disaster, psychological interventions. The first problem, or limitation, not the problem, please forgive me of that. In addition to that, I also had a lot of opportunity to understand stress in different situations. The disaster mental health area with Bhopal and other disasters, then working with persons with cancer, then persons with aging at this moment, what I'm doing as my area of interest, and caregivers. So from those perspectives, the area that I find it to be requiring in the third edition is spirituality. Let me just illustrate it so that you don't think he's talking about it because of his preoccupation with that. For example, Shivkumar's paper on aging and psychiatric illness, the chapter, Vanaprastha is not mentioned. Vanaprastha is very important. Zero transference, zero transcendence is a very, very important way of coping with aging is not even mentioned. So I think it's very important for us to look into these things for the next edition. The other thing which I notice is there is a lot of duplication. You also mentioned it, Somashekar. Each author is trying to talk about the beginning of it. And next edition, I would say, do the first section in a very bad manner and tell everyone don't refer to those things. Just refer to that chapter and go on to your area of that work. The other most important thing is, which I would like to see it in the third edition, which I would like to call it, if I might suggest, take the liberty to suggest, stress, struggles, and serenity. Why am I saying this serenity? In 1982, when ICMR came out with a research idea, they used the yoga long before yoga became very, very popular in this area. Because serenity coming out of stress is the most important aspect for me in my work with disaster, with cancer, caregivers, now with aging. And as you know, this weekend, there is a 2-day international conference on cultural resources for mental health care. So my own request to you, congratulations, very good work done. Avoid duplication, add this new dimension of the positivity. You did mention about post-traumatic growth, but I couldn't find it in the chapter that I read. Probably it could be there somewhere else. I think there is a lot that can be communicated to the community that stress could be leading to serenity rather than struggles. Thank you very much for this opportunity. When the book announcement came, I asked Manjunath, saying that is it in our library so that I could go and read there. Then he said, no, don't worry, sir, I will send you a copy. And he was very kind enough to send me the electronic copy and then the hard copy. Thank you very much. Congratulations to all of you. I have pointed out some of the things so that it will be useful for your next edition of the book. Thank you very much.
Thank you very much, sir, for your wonderful, insightful comments. Uh, we saw that Jaya Modi ma'am had raised hand. Ma'am, would you want to?
Yes. Um, can you hear me?
Yes, ma'am.
Yes. So I'm consultant psychiatrist in UK in London, and this was really a privilege to attend this workshop as a BEPA member. I'm member of a British British Indian Psychiatric Association. I was not aware of this book at all, and really I feel so privileged that I was able to attend and I know about this book because the group of patients that we see in UK, is most of the presentation is in context of the stress, different life stresses, and we always think that is this something which the mental health, because here we have secondary mental health services and a bit different ways of working because we are very reluctant to give the diagnosis to the patient because they are stuck in the mental health services for lifelong. It's so helpful to understand how stress contributes to our well-being and how we can treat for stress without a diagnosis. That's what you covered, even irrespective of the diagnosis. So I would be very keen on reading this book, and I think it's available as electronic copy, isn't it? That's what Dr. Chaturvedi said. So if you can let us know how we can, so that I can let other members of the BEPA know as well. I don't know anyone is attending, but it will be really helpful if we are able to have access to this book. Thank you.
Yeah, it is available on Amazon Kindle and Google Reader.
Okay, thank you. Thanks so much.
Thank you very much, ma'am. We have opportunity for one more reader review before we move ahead. Do we have anyone? If not, I would. Yes, sir. Yes, sir. Sir, you're on mute, sir. R.S. Murthy, sir.
Very, very quick one. I wanted to say this. Very interestingly, the motto of Nimhans is Samatva Yoga Uchayate. Equanimity is the goal of all existence, which is the opposite of stress. This was chosen by the founders of All India Institute of Mental Health in 1954, when we had no idea about all of these issues. And to my mind, this could be the greatest contribution of India. The same way yoga, meditation has become international days, I expect in the next 5 years, equanimity to become a similar world day. And that can be done if we can convert philosophy into practice. Just so that you say that you are giving too many advices. I am at this moment working for this whole of this year on behalf of the Dalai Lama Foundation on spiritual approaches to successful aging. If anyone is interested, I'll be very happy to coordinate. But let's think about our rich resource that exists in it much, much before Celia talked about it. Thank you very much.
Thank you, sir. Thank you very much. In the meantime, we also have our other editors, Dr. Bhavika ma'am and Dr. Pratik sir here. Could I request you to share your experience briefly on working on this book, sir and ma'am, please?
Hi, maybe I'll start. So, thank you for making us a part of this. And obviously, we're very grateful to our mentors, Professor S.K.C. sir and Dr. Somashekar and Dr. Manjunath, for giving us this opportunity. And I'll not take a lot of time, but I think my experience working on the book was very, very positive. We also had Dr. Yasir, who's another higher trainee in the UK, like me and Bhavika. So I think stress is something that all of us go through at different stages, possibly on a daily basis sometimes. And I think what I just wanted to highlight, I work with children and young people, and um, even the same stress is perceived differently by different individuals based on some intrinsic characteristics and vulnerabilities. I just wanted to highlight that. So even if multiple people are going through the same stressful event, how they respond to it or how they grow from it is contingent on some individual characteristics, and these individual characteristics are highlighted in vulnerable groups like young people and children, or women, or refugees. Uh, I won't say that I'm a refugee necessarily because I'm in the UK, but I am definitely an immigrant in the UK, and I have experienced some level of stress myself moving to a different country, and sometimes you can only make sense of a particular experience once you've gone through it. So, it's just to say that uh, Professor Murthy was talking about post-traumatic growth, and that's where resilience comes in. So I think working on this book, challenging myself by moving to a new country from Nimhans to now the Maudsley, I think I have also growth. I have also grown, and I have also become more resilient. So, and the book has only highlighted the importance of all of this for me. And yeah, I'll pass on to Bhavika, but again, a heartful uh, thank you and much gratitude to all my mentors.
Thank you so much, Prateek. I echo everything that you said, and thank you so much, Dr. Somashekar, as well, for beautifully summarizing the book. My regards to Professor Chaturvedi and Dr. Manjunatha sir and Dr. Somashekar sir for giving the opportunity to work on this wonderful piece of book, which has brought together so many aspects that you covered, which we could use in our day-to-day life. I think as a trainee, I really experienced this paradox of choice, where there were so many resources out there. There's abundance of sort of resources, but it's so difficult to kind of pick on something and read through it. And when you find something, it's either heavily speaking about one aspect, like it could be therapy or biological underpinnings or something like that. But I think having a book which talks about all these aspects together um, kind of helps in day-to-day clinical practice. It's got aspects that helps a trainee from a individual perspective, from a professional perspective of making sense of what's happening around them. So I think it's a lovely book for any trainee mental health professional, and hopefully more people read it. And thank you so much, Professor Murthy, for giving a feedback on what are the other aspects that we could add moving forward. So it was quite helpful, and I learned quite a lot working on this book. Thank you so much to all the editors for this opportunity.
Others. So it's nice to see it's nice to see so many people. I'll just tell about some other parts of the book. It was a stress to bring out the book because after the first edition, we wanted to have a second edition, and it was getting difficult. And then we had, Manjunath chipped in, and even the first edition, it was because if you're seeing lights, I mean, the current is going on and off. I'm in Barsana, the Radha Rani's place, and it's been Radha Ashmi just a couple of days back. So I'm in a very, what shall I say, spiritual environment. So we had these two young colleagues of mine, Bhavika and Prateek, who helped in completing this book. I can tell you from the bottom of my heart, it would not have been possible without the two of you and Yasir. So it was really very good that you did all the work. Prateek, we are all immigrants in this world. So don't think that you are an immigrant. We are all immigrant. And Somashekar, good luck to you. Dr. RSM has already given you some stress to bring out the third edition. So start working on it straight away. And Dr. Murthy is always a motivator. He's also a stress giver. So that's how he has given you stress to bring out the third edition. But I think his ideas are very good. I really don't understand Dr. Murthy and others. Why do they consider aging as people who are really old? Oh, we have aged. It is the younger ones who are aging. So it should be considered in a very different way. But that's a very good idea. The third edition maybe should be more focused on, avoid repetitions and have some good content. I mean, we were talking in BIPA, Sridevi and Bhavika and Somashekar and Pratik, that the book is 6 kg. It's like reminded me of Grey's Anatomy. We can take it and do like dumbbells with the book, and it will reduce all our stress. So anyway, congratulations once again, Somashekar, and my other co-editors with this. And thanks, Manjunath and Gajanan, for bringing this, and Dr. RSM and Dr. Ghosh and others who are here for finding time for this. Thank you very much.
Thank you very much, sir, for your perspectives as a senior editor. And before I conclude, I would want to mention a small experience of mine where, as a trainee 3 years back, it would always happen that when we presented anything with respect to delusion, hallucination, what I communicated and what my consultants understood was the same. The moment stress came, I would always face challenges because what I presented as stress and what my consultant wanted it to be was always different. So it always felt like there was a conceptual lack of clarity for me as a trainee, and that was something which even my co-PGs shared. And when the first edition of this book was shared by Manjunath sir to me, and that is where it was like an eye-opener when we started as SRs teaching our JRs that stress is not just what you think of stress when you just pass your MBBS and come, because they would use the word left, right, center. Then it so happened that so much of conceptual clarity we got and we started passing on to our JRs. So in total, this book has been actually a really eye opener for all of us. In fact, so with this, I would really like to thank everybody who has been part of today's webinar, including SKC sir, Somashekar sir, RS Murthy sir, Pratik sir and Bhavika ma'am, and all others, and my mentor, Dr. Manjunatha sir. With this, we are coming to the end of today's webinar. I extend my warm regards on behalf of the Anxiety Disorders Clinic, Unit 5, Department of Psychiatry, NIMHANS, Bangalore, for making this webinar possible today. Thank you, one and all, and we conclude today's webinar. Thank you.